With a conversion rate exceeding 63%, Niagara Health has been recognized for its outstanding organ and tissue donation efforts for the fourth time by the Trillium Gift of Life Network. Dr. Hari Vasan is a donation physician and Niagara Health's director of the Clinical Care Response Team. Dr. Vasan, the conversion rate, can you explain how that is exactly calculated?
So the conversion rate is a calculation based on the number of eligible donors who are actually able to donate, who are converted into actual donors. So we're very proud of our efforts at Niagara Health, and I'm very thankful to all of the staff at Niagara Health for making this happen, because it's a big honor to win another conversion rate award. We've won several in the past few years, and it's really a testament to how committed everyone is to make sure that the wishes of those people who wish to donate are actually honored and come to reality.
That's very important, that it is the wishes of those people who do wish to donate, and their families are involved in that decision in many cases. You're involved in critical care, so that decision has to be made usually long before someone is in the operating room.
That's right. So the decision to become a donor can be made by anybody over the age of 16 at any time. And so it's really easy to register your wish to be a donor. You know, in the old days, we used to have an organ donor card. Probably a lot of people are familiar with those.
Right.
Now we have phased those out for several years now. So there's really two main ways to register to become a donor. By far the easiest way is to go to beadonor.ca. And you can actually check there if you can't remember whether you registered in the past, because some people don't know if they registered. You can actually go there and check to see if you are registered. And if you're not, it literally takes 2 minutes. You can do it on your phone. I have myself. And 2 minutes later, you can actually register your intent to donate. And if you prefer the old-fashioned way, you can go up to a Service Ontario kiosk and you can register in person. So that's the first step. The second step is to talk to your family, because it's really important that your family knows your wishes.
Exactly.
If something were to happen to you, it's really important that everyone knows and everyone's on board with honoring your wishes.
It shouldn't be a surprise to them on the day that happens.
Ideally, that's right. And if it is, that's okay too. What will happen is if you have something tragic has happened, and if you're either passing away or you already have passed away, the Trillium Gift of Life will approach your family and inform them of your intent to donate, of the fact that you are registered. But it's obviously much better if you've already talked to your family in advance.
I know about your involvement at the hospital in all of this, but what's even more important, I should say, maybe not important, but more interesting, is the fact that you have a story that involves your own family.
Yes. So my father, who passed away in 2016, was a recipient of a kidney in the early 90s. So I was a kid, and prior to that, he had suffered from kidney failure, and he was on dialysis for a long time. First dialysis in the hospital, and then dialysis at home, and that really affected his quality of his life and his ability to work. And so he was on the transplant recipient list for a long time, and then one day we got the call, and he was fortunate to receive a kidney, and everything went really well. His transplant actually functioned for over 20 years,
wow,
which is
it's
a long
amazing
time, and so he was able to go back to work full time as a lawyer and become a productive member of society again. And we were very thankful. I'll never know the name of the person who donated,
right,
but I'm so thankful that they did, because it made a huge difference in his life and in our lives.
Dr. Vasan, is that what perhaps inspired you to become a physician?
Oh, definitely, absolutely. As a kid, I spent a lot of time in hospitals and going to doctor visits with my dad, and that definitely played a huge role in my not only becoming a physician, but then working also in critical care. You
made that decision too, which is really, really interesting as well.
Yeah, I think critical care. We see patients and families often at a very difficult time in their lives. And that presents both feelings of loss, but it can also present feelings of hope. The hope that we can honor the wishes of somebody who wants to donate, and the hope that somebody who's waiting on the transplant list. We have 1,247 people in Ontario right now waiting for an organ transplant, and every 3 days somebody passes away on that list waiting for a transplant.
Right.
So if we can facilitate the people who wish to donate actually becoming organ donors and then facilitate somebody actually receiving a transplant and saving that person's life. It is such an honor to be able to do that, and I'm proud of our efforts at Niagara Health.
What are some of the numbers at Niagara Health as far as how many people have benefited from that in the past, I guess, year or 2 years?
So in the last year, we've had 13 donors who've saved 32 lives. And how is that possible? Well, there was 22 kidneys donated. We had 6 lungs donated, 5 livers donated, and perhaps most impressively, 3 hearts donated. And you can just imagine the enormous difference in the people who received those organs, what a difference that would have made in their lives. And and then there's people who donated tissue as well, and that enhances the lives of many more people as well.
When you talk about those numbers, 13 donors from Niagara, but were those organs used here in Niagara or elsewhere?
Yeah, so how the process works is that the Trillium Gift of Life will, assess the suitability of the organs for transplantation. And then based on the people on the list and the matching criteria, which is all a very complicated process, they will assign those organs. And first, they will try to assign them to somebody within the province. If there's no suitable match within the province, then it's extended to the other provinces, so throughout the nation. And then sometimes in occasional circumstances, if there's no match in the nation, those organs can sometimes be offered to patients in other countries, most obviously the United States.
A life saved is a life saved. That's amazing.
Right.
32
Right.
lives.
Yeah.
Again, we want to encourage people during the month of April. It's Be a Donor Month. Again, how should people go about making sure that their wishes are honored?
Yeah. So again, when they've done polls in the past, 90% of people support organ donation. And yet we have only 1 in 3 people registered to become an organ donor. And so what we need to do is match what people want to actually making it happen. And again, the best way to do that is to go to beadonor.ca, make sure that you're registered, make sure you talk to your loved ones about your wishes, and then, hopefully we can make that happen.
Dr. Vasan, thanks for sharing this with us
Thank you
today.
very much for having me today, Mike.